I think we'll go ahead and get started. First step, we have minutes from our last meeting in October, which seems like forever ago already. Any changes or edits to the minutes from October? Okay, entertain a motion to approve.
I approve.
Need a second?
I wasn't here.
I know.
We can't. I'll second, in good faith.
Okay. All those in favor, say aye.
Aye.
None opposed? All right. Minutes are approved. All right, 2019 meeting schedule review. There was a revision, I believe, for April.
Yeah, we had originally scheduled Good Friday, and so we changed that date then to April 12th. So I just wanted to make you all aware that that was a change going forward, and that should work if it works for everyone else.
I think so. Okay. And then an introduction for Lori, who called us all to remind us of this meeting.
Yes, so Lori Sal, who is right over there, she is taking Linda Anderson's place. So she has been with us well, she's worked at the health department. She was in the clinic area, and now she's in our area. So Lori, I was going to make you just say a few words. Is that okay? Will you do that? Just to say, a little bit about yourself. But you have to pull your mic down.
Favorite colors and animals? those sort of-
Absolutely. Just very
Very
sweet. I'm Lori Sal. I live in Hickson, North Dakota. I was previously with the city of West Fargo and Alaris Securities, and I'm happy to be here with you. Thank you, Lori. We're very, very happy to have her, although we love our Linda as well.
Welcome, Lori. National Association of Local Boards of Health, a status update.
Yeah, so I just put that out to the members. This is something that we've had a membership for, but there's been several other local public health departments that have kind of dropped the membership. When I had Justin do some research with me as well, it seems like it's mainly for boards of health that really have that more governing role. And so I don't know that it's necessarily worth the $300 investment to re-up. It does appear that you can access resources, that you can attend national conferences without being a member. And so I guess that would be my recommendation, if you guys are okay with that, is to just, if we need to access it as a non-member, we can do that. But I just don't know that we were getting the value from that membership if everyone is on board.
Did anyone locally even participate in, like, their national, must have national committees and things like that, and when there was never any interest either?
Not that I'm aware of. I tried to, kind of pull our members, and no one really had any recollection of it. I don't even know if we were really getting a lot of email correspondence. I couldn't find anything.
Okay.
I had reached out to Ruth, and I never heard back anything. So kind of just trying to formulate a decision based on maybe not a lot of, other than the fact that it really does seem to apply more to boards of health that have that sole governance in their areas.
Because they can be incredibly valuable. I'm involved
Yep.
nationally on as many things as I could possibly be involved on, and I've learned an incredible amount. But if we're not participating, that's reason enough to not do it.
Yeah, and like I said, I think the conference, then they have a national conference every year, and that, I think, if someone had interest, we could explore that, and you wouldn't have to be a member to do that.
Or pay
But-
$5 more or something.
Right,
Yeah.
100, I think it was $100 more or something
Okay.
like that. So.
Okay.
Thank you.
Did you need us to vote on that? I'm just continuing that.
Yeah, probably not. I mean, I
Okay.
I don't know that you voted to do it, and so I don't know that you need to vote to undo it. So it's, I just wanted your
Anybody?
guidance.
Go ahead.
Is it in the budget?
Technically, yes.
So you should do a motion to adjust. the
Yeah, I
budget.
don't know that it's specified in the.
Yeah, it's not a line item. It's
Oh,
just-
okay.
Yeah,
It's
no,
just
it
a- yeah,
came out
part
of
of-
the
part of the
general.
total.
Right, so it would have been out of dues
Okay.
and membership probably, which
Yes.
isn't really specific. So
Okay.
that's why I said there isn't really any like record that, yes, we did, so that's why kind of thing. I just keep getting the reminders that it's time to re-up, and so that's kind of how it came up.
Okay.
They get those emails through them.
Yeah.
That's absolutely.
Okay. Does anybody else have strong feelings or thoughts on participating or continuing that membership? I think there's a lot of other avenues that we have through SACHO and HO and those types of things too to explore. Okay.
Thank
All right, next up is budgets. I'm going to guess that's Melissa over there.
I have here through October, and in October, we were kind of a little bit behind in the, I'll say, grants billing area, which is pretty typical. July 1 is when a lot of the grants start over, although lots of our dates are changing to August 1, September 1, October 1. So that makes a difference in the timeline of getting the grant started. So that makes a difference in the reimbursement. They are looking pretty good. I did do a look ahead at the November numbers. I've got them, I just haven't been able to print them yet. And in November, we're already at almost 84% revenue. So that, looking at the numbers quickly, we should hit 100% pretty easily there, should go over as usual. And the expenses for November were at 89%, so they didn't go up quite as much. December will be a bigger month in just mostly the payroll area as they push back the last 2 weeks of December back to 2018. So December will look like a 3 pay period month again. So if you have any questions about any specific line item, everything is normal.
Any questions? Great, thanks, Melissa. I just thought of something. Lynn, do you know Chad? Okay, we should maybe do a formal introduction, sorry.
Hi, I'm Chad Peterson. I'm representing Cass County. I've taken over the social services portfolio, and what that does, that goes hand in hand like we do with our sheriff's portfolio. A lot of things are tied together, so that's why I'm here. I was here probably 3 years ago as well, so hi.
Fern looks a little different these days.
Yeah, Vern lost his hair.
Sorry about that.
Yeah, it's a tough
Occurred to
break.
me that, all right. Okay. Well, welcome, Chad.
Thank you.
All right. Third quarter statistics. Not sure who's going to.
Well, I can start, and then we'll have everybody jump in if they want to. But these are our statistics. The only thing that I was going to point out for Suzanne, who's our Director of Nursing, just to note that under the Nurse Family Partnership Program, which is our home visitation program for first-time moms, that's our program that's tied in with the national program. So the national program has changed their data collection system, and they're having some technical issues. So we don't have current statistics for that Nurse Family Partnership Program. We're missing a month of the RN visits. So she just wanted me to point that out. But otherwise, Grant, Larry, is anything that we are, from your statistics, that needs, or if you guys see anything you have questions on?
I'll just point out, there's a couple new ones, or not new ones, but different new data sets we're collecting. The ones is on aquatic on-site testing inspection. So that's why we don't see any past data for that one. There's that one as well as childcare inspection. So that's a new one going forward that we're trending and capturing those data. And so you'll see those. So that's why there's any previous year-to-date and third quarter data.
In relationship to the clinic, things are continue to stay relatively consistent. We're still seeing a large number of clients. At times tends to be quite complex We try to hone in on primarily family planning services with some of our clients that are coming in. We're finding their visit to our family planning clinic is probably the only provider that they see throughout the year. So they're very fortunate to have a clinic that utilizes a sliding fee scale that bills insurance, and being a Title X federally funded clinic, we never turn away anybody due to inability to pay. So our goal as a clinic for this upcoming year is we're looking at ways to continue to outreach and look at high-risk populations in our communities. Again, hoping and working with them, different individuals in the community, to utilize our services, to eliminate as many barriers as we can. That could be individuals that participate in our harm reduction program, could be individuals in our WIC programs or other programs. So again, as a clinic, we're going to continue to reach out to some of those agencies and organizations in hopes that they do utilize, because again, research has shown, and we found it ourselves, that oftentimes many individuals utilize family planning services and might not go to see a provider for other things throughout the year. So with that, otherwise our health tracks, as we've talked about in the past, we continue to serve as a safety net, providing health track services at this time on Mondays for individuals who possibly cannot, or for some reason are unable to utilize the health track screening services at the 2 other sites in the Fargo area. And lab continues to be busy as well. Having one lab person, she tends to be quite busy with all the HIV tests, hepatitis C tests, STD lab tests, and all the other programs that she's involved in. And that's my comments.
So as far as the clinic goes, you mentioned that, there's maybe a need for them to go further to like a primary care provider. So is there like a regular established like touch point that you have with any of the health systems in town to kind of assess availability, or what are their barriers in getting to those?
Well, one thing that we do with our clients is we talk to them about the various clinics in our community. For example, we'll have somebody that will come in and want us to address their asthma, want us to address their depression, and when we have so many providers, specialists in our community, we would like them to utilize a psychiatrist, psychologist, and so on. I feel our nurse practitioners in our clinic are experts in family planning services. So we try to hone that in so they can really focus on that area and refer elsewhere. We do meet with various facilities, agencies for the referral piece. For example, it's really exciting to know in our community that Family Health Care started in October 2018 is providing a great deal of hepatitis C treatment. And they have developed and expanded their program, and we are meeting with them in January to talk about how we can possibly collaborate, work together, because we do a large number of hepatitis C and HIV testing in our community as being a contracted North Dakota Department of Health testing site. So I just think that's going to strengthen our relationship with them and in return provide better care for the clients in our community.
Excellent. Thanks, Larry. Any other things that folks want to point out with regards to the stats? Otherwise, I think I do have a few other questions. All right, school health looked like it was up a lot. So I was just curious if we have any background on what's driving that.
Yeah, and that could have been, if they do, Because they count direct contacts, so if there's presentations or things that could change those
Okay.
numbers. I mean, I think from a nursing services standpoint, it's been fairly consistent.
Okay. I just wasn't sure if there's more touch points with the kids in the schools that are needing nursing services or what was driving that. Okay.
I have a quick question, and this is my first time looking at this, so I'm not sure I'm looking at it, or how to look at this, but the total visits for the health protection promotion section are down quite a bit from the year before. Third quarter's comparison, and then the year-to-date comparisons.
Yes. Primarily in our clinic, you know, I even mistakenly call it the family planning clinic. And I do that because that tends to be our busiest program in our clinic. But that is the number of all of our programs combined in our total visits. We don't break out things such as we have individuals coming to our clinic for triage, come in to be checked for head lice. You know, some of those things. But all of our visits combined, majority of these visits are all the visits that come to the clinic combined. We used to include in our statistics clients, total clients, and we used to include unduplicated, and sometimes we still do unduplicated users. The problem with doing that, and we use a system called Ehlers to track our family planning numbers. And according to Ehlers, unduplicated users is just how many specific individuals that come. So if I come to utilize services from the clinic and I come 5 times, they only count me once, regardless. And it causes some confusion, you know, with that. So yes, there is a decrease in the numbers, but it doesn't take into account our health tracks numbers and these numbers. We have an immunization program that has these numbers as well, but they're not specific to that. But the numbers have slowly throughout the state decreased. And in talking to the staff, we really want to, you know, continue with our niche and reaching out to the high-risk individuals. So in 2019, we're making more of an effort to do that. We've started that somewhat. We have a nurse practitioner now that actually has been doing more outreach. Just last week, she met with school nurses. We reached out to a couple other organizations in the community that are higher risk. And many of those individuals, not only are they high risk, they do not have insurance or they're underinsured. So we just want them to be able to come to a place and receive good quality care, and again, regardless with ability to pay. However, being fiscally responsible to the taxpayer, at the same time, is if somebody does have health insurance, we have a billing department that's able to bill for those services.
Thank you for that explanation. I appreciate it.
Yep.
Other questions? Jeff?
Probably not a big deal, but third quarter, the failure rate of Fargo's smoking is wrong. It's not 98%, it's 92, so it's about 92 before, 92 now. Just an error in typing, and I'm sure no one looks at these, so. If you're really bored, change that.
Oh,
It's just, they took 8 minus, 106 minus 8, 98.
Yes.
Sorry to be that guy.
okay.
My first meeting.
Probably,
He's a
probably
number
set
guy.
up in the formula wrong, would be my guess.
Yeah, is it a spreadsheet? So it should be populated? Okay.
Yes.
Yeah, and just
That was my worry, if you track it over time.
Yeah, right.
you know, and with that, I think it's important to point out as well. I don't think we talk enough about that, but what a great job as a whole our community does with carding and helping prevent tobacco sales to minors. You know, we work with our local law enforcement agency to provide compliance checks, and we're consistently over 90%. And oftentimes what we find is when there is a sale to a minor, you know, education oftentimes is what's needed, and we really work with the business establishment to not automatically fire the person, because sometimes I think that's just a knee-jerk reaction, is, oh, they sold to a minor, fire them. Well, were they shown how to check an ID? Do they know what a real ID looks like? Oftentimes you can, our cash registers now are like computers, and do they know how to correctly work that? And oftentimes what we find out is just some additional training and orientation with that employee is enough. So again, I don't think sometimes we give enough kudos to our community relationship, to the good job they do to try to limit the tobacco access to youth. So we're consistently well over 90% on that.
So staying on that theme, I know that somebody had asked me about, there's potential, I don't know if they're bringing it forward as trying to get somebody to sponsor a bill related to raising the age to 21 for tobacco. So we don't, if you're not prepared to talk about it today, we can talk about it some other time. But I've been hearing rumors about that, and I wasn't sure if that was getting movement or not, and how.
Yeah,
you
I've
feel
been
about
hearing
that.
rumors as well.
Okay.
However, the majority of the conversations that I've been part of or heard is really focused around the tax and increasing the tobacco tax, and increase it by $1.50. And, I know that on the Minnesota side, there's maybe a little bit more conversations related to that. My understanding is there's communities in Minnesota that actually already have that. So at this point, I'm just hearing some kind of conversation, but mostly around the tobacco tax.
Okay. To which we passed a resolution last time, I think so. All right. Any other questions on the statistics? Okay. All right. Health officer update?
Yeah, so we have Dr. Lego with us, and so I was just going to have her, I said she didn't have to do the written report like Dr. Baird did, but just that she could just kind of introduce herself and just give some background in what she's been up to for us, so.
I'm Heidi Lego. I'd like,
Your
mic off.
Just
Sorry.
pull it close to you.
I am medically trained at UND, but go Bison. I'm still Bison. That was my undergrad. I am board certified in emergency medicine as well as emergency medical services. I'm a medical director for all of the services, and most of them in Cass County and all of them in Clay County, as well as Thief River and a bunch of other services. So, and I'm also a Clay County's public health officer, juvenile detention and detox medical director. So I branched out from my emergency medicine days. I've been just trying to get acquainted with all the policies and protocols and procedures and getting them all signed and learning people's names and faces and seeing where I can be most helpful. I've started going to a few meetings like hoarding and talking with the harm reduction folks about what services I can get involved in and those types of things. Signing lots of prescriptions. I think I had a hand cramp one day, but I signed about 100 or so. So, but just finding where I can be most useful at public health. I'm excited to be here, and I have enjoyed it so far.
Yes, thank you.
And Dr. Leko, it's a pleasure to have you here with us and providing your services. From my perspective, let us know what your best advice when you see opportunities to do that. Dr. Baird was very good at advising us and counseling us, and even at the legislative level, being a voice locally. So my sense, and just my perspective is give it your all, and don't sit and wait for permission always for the bureaucracy to kick in when we meet every other month. You'll have your relationship with our staff, and when there's health discussion issues coming legislatively, my guess is we will trust your voices strongly.
Great, thank you. Yep, I will do that.
Thank you. Any other questions for our new health officer?
I have my phone on me 24/7, so you can always give me a call if you have a question.
All right. Well, thank you. I know last time Commissioner Strand had asked for a shelter update, so I think Jan wasn't able to join us, but. if someone
Yeah,
else
Jan was
can
going
update.
to be here. She needed to be at the VA today, so Jillian, I don't know willingly if she came, but she came to give us an update. We had, Jan had updated at the city commission a couple weeks ago just on the kind of the status of, you know, how they go in to prepare for the winter season and kind of the status of all of the shelters working together. So Jillian's going to give us a little update on that.
I'm lucky today. Jillian Gold, Homeless Outreach Specialist with the Gladys Ray Shelter. We were able to get some updates from all of our shelter partners. Overflow has been off to a great start. New Life has consistently seen their 27 beds of overflow full. They do also offer a warm chair in their lobby if their overflow is full and somebody needs a warm space for the evening. So their priority is single men they have to be 100% sober to be there. Churches United is primarily focusing on families and single females. In November, they served 60 individuals. They've been consistently full as well, and are just finishing up the renovations of their basement. So they'll be able to have families down in the basement so that they have a little bit more privacy and family space there. Fraser LTD operates the Stepping Stones Resource Center, the homeless drop-in center for youth, and they have offered extended hours as of December 6th. So 18 to 24-year-olds, they have 16 overnight beds for them, and they've been seeing on average about 6 to 8 individuals a night. We weren't able to get any numbers from the Y. However, I know at Gladys Ray, we've been consistently full. Our bed space is usually for about 35 individuals. We've had upwards of 45 to 50, whether they're on a mat on the floor or in a chair. What's been reported to us is we're seeing a lot of folks that need to be with us. The goal with our shelter is to serve those that can't be served elsewhere, either due to their substance use or their mental health. So seeing a lot of folks with higher barriers still, which leads to them not having a place to go during the day. So that is still definitely something that we are hoping for, is that low barrier drop-in, because we have folks that are trespassed from the few places that they can drop in, and it's cold. So that is the update. If you guys have any questions, please let me know.
Questions?
If I could chime in as well, and Jan and Desi and some of you folks, we all met with some of the city administration. I'll say this, I'm really proud of our response proactively this year and our team's approach. What I sensed out of our roundtable discussion was to gather a sense of if there are any needs and what other needs. Some of them are like short-term transportation. So basically what came out of that session was, we'll come up with a little fund if that's what it takes, so that you're not sitting there hampered with the ability to make a decision when you're in the trenches and something's going on. So, but we have a lot to be proud of in our community, and that it's resting in public health's arena, to me, is really appropriate for this topic, and I hope the weather cooperates. But my kudos to all of you in your different capacities for what you're doing, and it'll show in the end of the year results when we come out of the winter and had no deaths and more people sheltered properly. So thank you for all that.
Yes, thank you very much. Okay, other questions? All right. Okay, performance management. So customer satisfaction survey, looks like Justin.
I know, I got a big grouping
All
of
right.
things all put together here. Customer satisfaction survey. At our last meeting, we discussed, we were developing, for Commissioner Peterson, I'll say, we created a customer satisfaction survey for the first time that really just wanted to address if there were hearing, if there was physical disabilities, if there was interpretation issues that we were having. We wanted to create a survey for our clients to then be able to, give us feedback. Are we doing the things that we need? Are we addressing this in the right capacity? Are we making sure that we're hearing what, concerns you have? So At the last one, when we just were getting it set, we were expecting all of 5. My very low ball estimate was 5 for the quarter. As of this morning, we were at 28. So we've gotten a very good response. And at the end of December, we will then create a little report so that we can get feedback, and then we'll bring it to the next meeting so everybody can see sort of what responses were, what we're hearing, and make sure that we have, the individual people from our staff that have been doing a great job, that have gotten comments that say, we really appreciate so-and-so for the work that they do. So also, I've been toying with it, is taking the satisfaction part off and just making it a customer survey, because we're not necessarily just wanting to make sure that they're satisfied. We want to make sure that we're just addressing different things, and we can tweak the survey over time. There's some responses we've seen that, we'd like a little bit more feedback. So maybe next quarter, we're going to add a little extra comment box here, or, if we have other questions that we want, if you, would you like to be referred to other divisions and things? So this is going to be one of those ongoing pieces that we're going to continually tweak here and there. So we'll work on that. And again, next meeting, I'll bring some actual statistics so everybody can see it, and I'll make it pretty. And Commissioner Strand knows I like to put colors on everything, so it'll look nice, I promise. Our all-staff survey has done really well. We talked about that at the previous meeting as well, to get a feel for where everybody was at. There were leadership meetings there 5, 6 leadership meetings, I think, that we really drilled down onto the responses and tried to categorize where we could, group where we could, find out where there's themes, find out ways that we can maybe address them. And the leadership sent back what they gleaned from the information to the staff. And then at this point, it'll go to a division level for just an ongoing discussion. And then it'll come back to leadership so then we can create some goals and objectives and measurable outcomes. So that's all part of that building process, and again, part of our performance management that we've really been trying to get more into. Very exciting news. Yesterday, I got confirmation from FAB. We received that our action plan was accepted. They liked it. So from yesterday, we have 1 year to get our documentation in order. Commissioner Peterson, we are going through.
It's Chad. I
So- or-
don't like labels.
Well, I was trying to be old-fashioned.
I got you.
Yes. So we're going through National Public Health Accreditation. They have, it's 4 years, 5 years that it's been out now. So national standards that require, whether it's state, local, tribal, multi-jurisdictional health units, so that we can then use national standards to make sure that we're doing the best we can for our community. We've gone through the process, well, it feels like 4 years now, but last year in November, we had a site visit, which they then checked documentation against our standards of, what they identified as needs. We worked through a couple of different things, and they identified that we still needed a little more, documentation on things. In North Dakota, we found that we do a lot of really great communication that don't get documented. Lots of phone calls, lots of quick conversations, and, very loose collaboratives that we work in that don't necessarily have a charter or these pieces that accreditation really enjoys. So we're working on making sure that we're documenting some of the things we do better. So with our action plan being approved now, there are identified through, how many was there? I think 7 of the 12 domains, little pieces within, and parts of it is communication with the Board of Health, improved as far as agency plans that we're working on, making sure that we're getting you drafts early so we can get your feedback and we can discuss the outcomes that we're looking for and the different goals that we're setting. And there's all those pieces. So now the action plan is done. I'm jumping back into our working on our health assessment, which will, I'm not going to set a deadline when we get it done because we're working with the Southeast counties as well on it. But we will be hitting that full force coming up. So that's exciting. We're really excited the action plan is approved and we're moving forward. Finally, the People Project, I'm going to leave to Desi to describe a little bit better, but it's a very exciting thing which plays into.
Yeah, so probably about a month or so ago, I was approached by Rory Beal and a regional person in that does Clay and Otter-Tail-Cooper counties in Minnesota. And so they are doing a pilot project that they would like us to be a part of that's called the People Project. And it's basically a project based around people's mental health, specifically our employees' mental health and well-being. And so we don't have a whole lot of information other than the curriculum was developed by an instructor at NDSU, and it's broken down into segments. So what we have two champions that we're going to have from our agency, which Justin is one, and then Chris from our environmental health department is the other one. And so they are going to, excuse me, go through training on these segments, and then they will bring that back to our staff. And, you know, we don't really know what that's going to quite look like, if it's going to be large group, if it's going to be division meetings, what it's going to be. And they would present these concepts and tools for staff, and then the intent is then for the staff over the next month or whatever after that is to practice these tools and different things that they can implement into their daily practice in order to improve mental health, and kind of, you know, whether it's looking at strengths or gratitude or different kind of concepts that I think will just be really beneficial for all of us.
Okay.
And so, like I said, we don't know a lot of it, but we're excited to hear about it more. So they are going to be contacting us in January to start this process. So it's exciting for us.
Parts of communication and culture, which will be very beneficial. Sorry, I went through everything fast. Does anybody have any questions on any of the multitudes?
What?
Yeah.
So regarding the last program, the exciting portion, how are you going to quantify whether it's worth your time, is a success, is not a success? What's the end goal, and what's the product that you can come back and say, we didn't waste our time doing this, here's what the result is X?
You're
Right.
talking about the People Project?
Correct.
Well, parts of it, like through our all-staff survey, we've identified, you know, some staff feel that we communicate really well. Some staff think that we don't communicate well. So, you know, we've gotten some like quantified measures already that we can then build out. So we can ask as we're going through this process, do you feel like communication is improving? Are you feeling like you're better in the know of other divisions, activities that are going on? There are going to be little pieces. Obviously, you know, getting to 100% is never really going to happen. But, you know, if we're making those efforts to improve, and especially division to division where we've been in the past very separate, there's going to be measurable outcomes that we can then identify just from all staff surveys, and then continued communication with staff. We've made that part of the effort of performance management where there is an ongoing discussion. So development through those different surveys and activities that we're doing is our goal for next year.
I also think, and I'm not for certain, but I would assume that with this project, because it's a pilot project and because it's evidence-based, typically evidence-based has some evaluation kind of components that are built into it. So I'm assuming that that is going to be coming with it as well.
Okay. Thank you.
And if I may, the other thing I would take a look at too is when we help people, give people tools to improve their mental health, you're going to see more productivity at work, so people will be missing work less, so that's measurable. And then I had another one, but then it went away. Oh, and then your surveys, you know, how do they feel before and then how do they feel afterwards? There was another one, I'll think of it later. But for sure you'll
Just keep
oh, and then
vibes,
retention.
vibes.
You'll,
Right,
when,
right.
when employees feel like they're being given tools to improve their lives, they're more likely to stay on their jobs too. So retention and
Right.
productivity, you'll see those numbers too, I'm sure.
And we also may be able to measure some engagement type of things as well, as far as participation in various things in our agency, is if someone's engaged or not.
Yeah, I think it's a great question. And so when you learn more in January about the program, since NDSU developed it, and if they're analyzing it, as was mentioned, there's got to be an evaluation component to it, but making sure that we're tracking that, to Chad's point, that it's worth the time and investment.
And I think this was like a grant funding thing too, so I'm sure there's some requirements for reporting that they have from the grant as well.
Usually is.
I also want to point out, Holly Scott is here. She is responsible for me knowing to put that QR code on our customer survey, so thank you, Holly, for that.
Thanks, Holly. Any other questions for Justin or Desi on that agenda topic? Okay. Well, I mentioned to Desi right before we got started that we probably should just put a standing item of legislative issues on the agenda. I know we talked through a number of them last time, so I'm not sure if anybody has anything specific that they would like to bring up at this point. Chad?
Thank you. I'm talking a lot in my first meeting, sorry. So I tend to be very active legislatively. I sit on the County Commissioner Association as well, so I'm on the legislative committee. I have been since I was elected. So if something is happening in Bismarck, there's a probable chance that I'm actually in Bismarck at the time. So if you need, I think if you don't have my email or phone number, ask me and I'll get you, text me, email me whenever you need to. I don't sleep a lot, so either, so just whenever, 24 hours a day is perfectly fine. But I will be in Bismarck participating, as well as if we need something from the counties to advocate for. Share whatever your thoughts are, because as Mr. Strand said, Commissioner Strand said prior, we rely on you as experts to judge what is and is not right, and then we can lobby for or against accordingly, if we agree that it's right or wrong. But know that I'm active in Bismarck. I will be active in Bismarck. If you need my help, let me know.
I'm participating on the legislative rapid response team for the North Dakota Center for Nursing and the North Dakota Nurses Association. So nursing specific, I should know about those things, but if there's anything you need me to look at, if I can't make it, we have a team of people that will take turns, so you can let me know about those two.
And anything insurance related, right? And healthcare in general, I kind of.
Yeah, we do have, Monday morning, the city of Fargo and the city of West Fargo are having like a little legislative meet and greet, just to talk about kind of priorities for the city. So we did have to just present to the city administrator just the things we were kind of looking, from a health standpoint. And really, so far, those main things are, of course, our state aid is a big concern that we want to make sure that those levels stay either where they're at or up. And then the tobacco tax was the other one. And then Grant, maybe you can just address just the sewer, if septic, but they're kind of hoping that might come out of session.
Yeah, thank you. With the on-site septic program out in the counties, for people that don't have access to municipal wastewater, availability of wastewater systems, what we're looking at is we're just monitoring it because for years we haven't had any state entity that's held that as far as accountability. It's underneath the plumbing code going back to the 70s, and they don't want to have anything to do with it. So we've kind of gone at a grassroots level as far as a local counterparts across the state to try to develop a consistent, uniform code. And so we're hoping and we're watching that someday it'll be either administrative or century code to some degree at the state level. So then it'll be blanketed across at a state level for authority. Because right now we have to go to each county commissioner board of health, and that gets really political, and some want it, some don't want it, and it tends to break up the consistency and uniformity across the state. So right now there's possibly industry that might even propose legislation, because when they're out in the field, they can see in the bidding process that it's just not apples to apples. And obviously, on-site septic systems are intended to protect, one, the consumer or homeowner, especially when you build a new home and you put a lot of money into it, you don't want to have problems with your septic. And then we don't want the environment and the groundwater, that leachate system. It's supposed to do its job like a sponge and kind of collect the bad stuff, quote unquote, before it gets in the groundwater. So we've been watching that for years, and we don't know if there is any traction to it, but that's something where if you do hear anything about it, I'd like to know. Appreciate it.
Okay. Any other legislative items? I know we were talking briefly beforehand, there's a lot of things coming through DHS, and there's a lot of changes that the governor proposed in his budget. So there's a lot of things to consider, so. Okay. All right. Any other items for today?
And I sent you guys the email to invite you to our Christmas tea, if anybody's available. That's on December 19th, 1:30 to 3, I believe, and it's in our teaching kitchen, and It's just a nice time for our staff to come and just kind of have some holiday wishes. So we do have the ever-popular door decorating contest that's going on right now that's highly contested. So you can come and see what your thoughts are. Come take a selfie with Elvis, because he's in the building, so.
Okay. Excellent. Any other topics, questions, thoughts anybody wants to share? Okay. Well, I think our next meeting is February 15th. I think there's a lot of activity between now and February 15th from a legislative perspective, so reach out to any of us if you need us to do.
Yeah, absolutely. Send
anything.
emails if things come up on your guys' ends too as well. Reach out to us, that would be great, and we will do the same.
Okay, perfect. Well, I think we can go ahead and adjourn then. So, thank you.
Thank you.